We get over 24 families a month that are homeless. And if we really started knocking on the hotel doors, we'll probably find more. It's really hard to get out of homelessness. Otherwise, they just live in a crisis mode and do what they can figure to keep a roof over their heads and just keep doing the same thing over and over again.
More than 4,000 people in the state of South Carolina are experiencing homelessness. In the Low Country, it's more than 400 people, and about 80% of those in the Low Country is just in the Charleston area.
For the last 5 years or 6 years, we've been serving homeless veterans. Then the mayor asked us to take over this resource center for the homeless. A lot of people can't get into a shelter. There's no family shelters here. There's people that just can't be in a confined place because of a lot of the medical and mental health issues that we're addressing. What the Navigation Center does is coordinate that and really look at the root causes of why they're homeless. And really, the Navigation Center, we want it to be a medical and a mental health model to address the homelessness of these folks.
What you think of when you think of telehealth, you think, okay, the provider has a screen and the patient has a screen. But here we have use of 2 rooms. This room actually still is the room where we check in the patients. We get their vital signs. A medical student volunteer or other health professional student is here to do that. We get their kind of chief complaint, why they're here, and some of their past medical history. And then we go across the hall where we have a camera set up so the provider can see them, and there's a large screen and they can see the provider at MUSC.
We'll see everything from someone that comes in with a burn or to someone with diabetes that's having trouble managing their blood sugar. It's a really wide range of sort of acute issues as well as kind of more chronic everyday diseases.
There's a stethoscope where the volunteer in the room places it on the patient's chest or belly, whatever it is, and the provider is actually hearing that. So it's as if the provider was in the room. We have otoscopes, which is just a fancy word for a camera that we can use to look in people's mouths, eyes, ears. So with the help of the student volunteers, this telehealth really works, and we can see a large amount of patient complaints because we have this technology.
Telehealth is an amazing technology for us. They can just walk in and meet with MUSC and start their diagnosis, whether it's just prescriptions or if it's maybe they need to go be referred to a psychiatrist, maybe they need an operation. It's a way for them to start getting back healthy so they can make the right decisions and the right choices for their next steps.
This population's used to basically waiting until it's an emergency to seek care. Emergency room utilization among the homeless is, way beyond what it is in the general population. And so what we try to do is capture patients before things become emergent, and we're providing this care at a place where they already are. So there's no transportation barrier for the patient, and probably most importantly, they're at a place where they have trust. So this is often stigmatized and marginalized population, and often there's a lot of distrust with the medical system, understandably. And so we're providing this care at a place where they've already developed relationships and they have trust, and it's us coming to them in their space as opposed to vice versa.
This Navigation Center is a home for them. It's not just a medical home or a mental health home. It's also, they have laundry services. They help people get connected with resources. So this is a really supportive environment and a springboard for them to get what they need.
Every individual is different, just like every individual that has secure housing. So it's so important to recognize that and to listen to whatever part of their story they want to share. And beyond that, to just do the best job caring for them based on the situation that they're in. The caveat to that is being really careful to assess social determinants of health. Do you have transportation? Are you getting access to regular food sources? Do you have a job? Those things are really important to assess for all people, but definitely in this population in particular, because it will affect the medications that you're able to give. It'll affect the follow-up appointments you're able to make.
You know, your health, your mental health, all of it is intertwined with sometimes things that are out of your control and sometimes things that you can work toward. As a healthcare provider, you really need to be cognizant of where your patients are coming from, what their beliefs are, in order for you to partner with them to improve their health, and also in order for you to get them the resources that they need. And you won't know that unless you ask and you try to work toward being culturally aware of what's going on in all of your patients' lives. So it's a lifelong learning process.